Hello. Do you have a heel spur that is torturing you? If you've never had one, you can't really appreciate what that means. But if you do have one, you know it's pretty bad. We're going to show you an osteopressure treatment and an exercise that can really dial down the pain it causes you. Osteopressure is quite a wonderful thing we use here, and you have every right to be excited. We're simply going to press your heel spur away. So, how do you press on a heel spur? Mira and I are going to show you now. Let's first take the base piece and the top attachment with the point or something similar in case you don't have our osteopressure toolset yet. It should have this kind of shape and it should be rather on the soft side because we're going to work on the heel where the spur sits and it shouldn't be too hard. Check your kids' room, maybe your dog's toys, or find some other household item that would fit the description. And let's first look for the heel bone, feel around, and try to find your heel bone. And then you'll notice, if you press on the inside, you're pretty close to the spur because that's where they typically form. On the inside, that is. If you have a rough idea of the location and where it hurts, then you take the tool and press the point exactly on the spot that hurts. But be careful, very slowly and softly. And Mira, I think you have a spot that hurts, right? Get on it and press to reach 9, 9.5 on your personal pain scale. And now, what happens next? If the pain goes down, you're on the right spot, and then you'll realize it's not the heel spur that hurts, but that there is something on the heel bone itself that is sensitive that hurts. And if this is dialed down, then this also means that your heel spur is less sensitive. Stay on it. Don't be afraid. You may think, oh, it hurts, this is inflamed, I shouldn't press on it. That's absolutely wrong. Why? Well, of course, something is being repaired because these excessive tensions are under repair, because the tendon is pulling too hard on the bone. But when you press on it, the tensions go down for 2 minutes. And as a result, your body has the remaining 23 hours and 58 minutes to do its repair much better than if it were still under these excessive tensions. A chronic heel spur is nothing other than a heel spur that is under permanent tension. That's why it becomes chronic. So we don't believe in chronic. So let's swap out the top attachment for a rounded point. As you can see, it's rounder. And we go along this line. Why do we want to do that? There's a cord running from the heel to the toe. By the way, this is where the bunion, a hallux valgus, forms. This outward shift of a toe joint doesn't look so nice, and nobody wants to have one. And you could prevent this by relaxing everything here. And you go along this line with the rounded tip and look for tender spots. And if you find some, you at home, please do the same. If you find some, then stay on them just as you did with the heel. Stay on them for as long as it takes for the tensions to come down and free everything up there. And after the exercise, you'll feel the difference because your foot's going to feel much lighter, more flexible. You'll be rubbing your eyes in disbelief, but that is the effect from the osteopressure technique. This is a layperson's version of the therapy that the doctors and physical therapists trained by us use on their patients. The professional version of the technique, the benefits are immense, and with our helpers here, the osteopressure tools, you could use this technique yourself in the comfort of your home. If you should ever be in doubt whether you're on the right spots or have found them at all, then go to one of our therapists nearby, close to where you live, and have them show it to you. They'll explain it to you, maybe press on the spot to demonstrate the effect, and then you can go home and try it out yourself. In the meantime, Mira has almost reached the toe joint, I'll show you the area with the most sensitive spots, mostly here, that you've covered already, and the point, the heel spur itself, and that finishes up our osteopressure part. And now we can move directly to the exercises. Want to venture a guess what exercise this could be? It's one that works on the part we've just relaxed and stretched it. That means cross one leg over the other, and then you reach with your left hand around your toes like this to pull the foot back and use the ball of your hand to bend back toe so that you could build a wonderful stretch here and here. And now you start pulling. Pull the foot back as hard as you can, and then bend the toe, and wait for a moment so everything can yield there. It's already flexible thanks to the osteopressure we did a minute ago. Otherwise, you'd probably be unable to go into these angles at all. Increase the pull a bit, and then try to flex your toe, the big toe, down again as hard as you can, but still hold the toe back so it doesn't budge, even a millimeter. Flex hard, really hard. Flex it hard, really hard. Then relax and pull it backwards a bit more. And you'll notice that not only your toe goes back more, your foot does too. And then flex your foot as if you wanted to go down with it. But at the same time, you hold onto it. Your foot has a lot of power, so your arm has to do some real work here to hold the foot back. And keep pulling it back so that despite its power, it can't budge downward even a bit. Build up tension here and here. And remember, if you pull now, it'll hurt less afterwards, and that's the moment when everything starts to recover. The tensions and stress that have developed over time can be brought down. And slowly leave the position. And wiggle around your foot, loosen it up, bend it a bit, move it around. Well, that wraps up our exercise, and I bet your heel spur feels much less sensitive, which goes to show. It's not the heel spur that hurts, but those sensitive receptors we've dialed down. The spur itself, this outgrowth on your bone, may still remain, but the pain has probably been reduced dramatically. Please spread the word, pass this video on, share it with others, subscribe to our channel, and a thumbs up would be greatly appreciated. See you next time.